transition to the CDC high community COVID level. This basically means that as this happened or occurred as a result of increased admissions to our healthcare systems, as well as a growing case count here in the community. When a community is in the CDC high level, the CDC recommends that individuals, of course, and most importantly, stay up to date on vaccines, as well as they recommend individuals take multiple layers of protection, which does include wearing high quality face coverings when they're in high risk indoor public settings. So individuals in the community should consider wearing face coverings while we're in this higher level of community transmission of COVID. The data we have currently available does suggest that the majority of cases that currently are being sequenced in the county are the BA.5 lineage, and so certainly that subvariant does have the potential to transmit very easily, but also has the potential to potentially evade immunity that folks may have from either prior infections or vaccination. All evidence suggests that the vaccines are still highly effective at protecting against severe disease. We do not see a different level of morbidity with this particular subvariant, and so that, of course, leads us to continue to encourage folks to get vaccinated and boosted and stay up to date with that. Transitioning now to monkeypox, the situation of monkeypox continues to evolve here in Mecklenburg County, and I will pass it now to Joy Smith, our Communications Director, to give us a quick update on the data and where we are this morning. Then I'll come back and talk a little bit about vaccines.
Good morning, everybody. So as far as monkeypox, we are at a case count today of 33 cases. The information as far as the demographics of these cases have not changed. The majority of these cases are in Black MSMs. We continue our activities towards identifying contacts so that we can offer vaccine prophylactically after exposure, and also our vaccine allocation efforts.
Perfect. Thanks, Joy. And just to give an update on where we are with vaccine, we did receive notification this morning from the state that we will be receiving an additional 2,000 doses this week, which is great news for our community. As of this morning, I believe we have just over 1,800 individuals on the vaccine wait list. And so we will begin to reach out to those individuals as quickly as possible when that next shipment comes in. All of our current appointments are full, and we are working to ensure that we are reaching those at greatest risk in our community to ensure that they know that they can come in to get vaccinated. And of course, are looking to expand access as much as possible as more supply is made available. So with that, those are our updates for today. There are no changes at this time to the eligibility criteria for vaccine. As I mentioned earlier, we do have a very long wait list at this time with those that are currently eligible and are at the highest risk of exposure at this point. And so we are working to make sure we work through those networks first before we transition to more broader groups for prophylactic vaccination. So with that, we can go ahead and start taking questions.
First question today goes to Tony Mecia, Charlotte Ledger.
Hi, thanks for taking the questions. Just wondering, with the CDC guidance and the high transmission level, do you foresee any new recommendations to Mecklenburg County to either require masks indoors at government buildings, take a different approach on masking at schools, or have any sort of consider any sort of a mask mandate? And if you could explain your thinking on that. Thanks.
Sure. Thanks for the question, Tony. At this time, no, we're not considering any mandates of any sort in terms of mask wearing. As I believe you all will remember, we talked previously about the need to really ensure that everyone in our community knows what tools are available to them in terms of protection against COVID. And certainly, I think we have been at this for quite some time now and continue to communicate regularly about what tools are available to folks. And so I don't believe that at this time we would entertain any sort of enforcement tools, but are, of course, advising folks based on the current risk in the community.
Even government buildings? I mean, if the recommendation is to wear masks indoors from the CDC, do you foresee that happening in government buildings in Mecklenburg County?
Yeah, Tony, not at this time.
Okay, thank you.
Next question goes to Vanessa Ruffes, WCNC.
I had two questions, one from a COVID perspective and another from a monkeypox perspective. So I'll start with the COVID question. Over the weekend, we learned that President Biden had tested positive again for COVID in what doctors called rebound positivity. I wondered if you'd be able to explain rebound positivity based on the drug Paxlovid and how some people can get that.
Hey, Vanessa, sure. So I guess in short, what I'd say is essentially the antiviral Paxlovid works to repress or suppress viral replication in the body. Sometimes it works so well that it suppresses replication so much that then the person is able to, obviously, it reduces the impact that the virus is able to have on the body, which is the most important thing that it does, but also their test results would also potentially become positive as well. And so because of that, that viral replication, when the person's no longer taking Paxlovid, can start to pick back up. And so then you might have enough viral particles in the body to be detected on a test, and then the test will go back positive. It doesn't mean the person has a new infection or has been reinfected. It simply means that the viral activity has picked back up or rebounded after the treatment has ended, which typically, in most cases, the person won't become infectious again, and that level of detection where they can actually detect the virus, meaning the test is positive, should go away in several days.
Okay, so just to clarify, I think you said it, but you're not necessarily infectious, you're just testing positive. Because I saw that the president is isolating again just to be safe.
Yeah, and I think as has been said with the president's case, they're taking abundance of caution with all of his and how they respond. That may not be applicable or may not be feasible for the broader community.
Wonderful, thank you. And then my second question was the one regarding monkeypox. I had spoken to somebody who was with a local pride organization, and they were concerned with perhaps some of the pride events that are being planned and that are coming up, that there would be a potential for monkeypox to spread even more. Is the county doing anything to try to get ahead of that? Are there any, local education type, events that are being planned? Like I know the state recently did that town hall with Equality NC. Is there anything kind of on the local level being planned?
Sure, yeah. So, I first met with the local pride director. I want to say him and I talked maybe 5 or 6 weeks ago in anticipation of needing to coordinate with them as well as with other community partners who are who serve the LGBT community here locally. And so we've been working with them to plan a number of proactive communications as well as awareness activities, both during the Pride events, but also leading up to it. And so that work is happening with the Pride organization. But beyond Pride, of course, much of the transmission currently is not happening is actually all of it is not happening at public settings. And so we're working to also work to raise awareness among those sort of non-public events and obviously personal accountability for individuals as they are going about their everyday lives to ensure that we're getting the word out to the right population and those who are at greatest risk. And so we are working with Pride. We also worked with Charlotte Black Pride on their events. We were present there over the last, that occurred 2 weeks ago. And we'll have a presence at the upcoming Charlotte Pride events. We're also doing a whole host of other outreach activities, including health promotion campaigns on dating apps, and we're working with a number of the party promoters in the area again to do everything possible to reach out to those who are at greatest risk of infection at this point, get the word out, but also our hope is to bring vaccine to those settings as well as we can.
I did have a quick follow-up on the vaccine, if I could too. Thank you for your prior response. You said you're getting 2,000 doses. You have 18 people on the wait list. Are the 2,000 doses enough to get through those 1,800 people? Or is this a situation where it's like first dose, second dose, and so maybe you'll get through half of them?
Yeah, so right now we're hopeful that we're able to make a significant dent in the wait list with the allocation that's coming this week, as well as what we're doing currently. We're updating the wait list in real time, so as people are able to schedule, they're being taken off the wait list, so that number is a live number. We are hopeful that the 2,000 will help us, but we are working with the state very closely to advocate for as much as possible, given that demand is so great here in Mecklenburg County. And so we will get through as much of that in the next week and a half or so before we look to potentially even transferring more vaccine from other places where the demand may not be as high. And so I think we are all hands on deck at this point to try to get as many folks in the high risk group vaccinated, and also want to make sure we're being intentional to make sure those at greatest risk are getting in to get vaccinated as well.
Thank you.
Next question is Casey Jones, Queen City News.
Good morning. Thank you for calling on me. So I want to talk a little bit about the misinformation surrounding monkeypox, and even here locally. You know, there was a post circulating last week about there being 4 employees at the Target that had it, and we've seen other just posts that aren't true. So can you talk about what people need to know when it comes to misinformation and how this type of misinformation could exacerbate infectious disease outbreaks?
Sure. Thanks, Casey. I appreciate that question a lot. Certainly part of the reason why we are doing this today, and we'll continue to do these as needed, is to try to make sure that we are proactively communicating to the community about what's going on with monkeypox. Our team, Joy's team, works really, really hard to identify as much as we can about the cases. And I'm going to start with that comment because I think it's important. When our nurses reach out to folks in the community and talk to people, one of the things we're trying to do is to identify where they have potentially been exposed, but also who they have been potentially exposed, and if they are linked to any of the other cases that we are aware of. And that whole process, which takes a lot of time and trust, is really important. But we use that to be able to determine when there might be either clusters of cases or cases connected to an event. And so that process is very important, and it's important that we get it right. And so I'll reiterate the request to the community that when the nurses call, please be transparent, honest, and share with them as much detail as possible about your everyday life, because it helps us to make those linkages as necessary so that we can inform not just individuals who may be at risk, but the broader community if there is any risk. So that's really important. Specifically about your question, the situation at Target, we did investigate and look into it. And Joy can speak more, but at this time, we don't have any evidence to support that there were any clusters at the Target in Metropolitan. I think it's important for people to recognize that this is very serious. Our work in public health to address health issues in the community is something that's very serious. And so we shouldn't be using it in a way that could be malicious or is not appropriate. And so we will communicate if we find clusters that are of consequence and there's some public health risk for the general public. But that information should be coming from the county health department only and not from individuals in the community.
And a quick follow-up, if I may, what are some of the most common myths that you've been, hearing? Do you have time to debunk any of them for the public?
So I think the most common thing that we've been hearing about monkeypox is that, of course, it is exclusive to gay men, gay or bisexual men, and that's frankly not true. And so I think it's important for us to continue to reemphasize to the community that while it may currently be most impacting those networks, that is not, in fact, that's not the only group that's possible to be impacted. And it's also important for us to reduce transmission so that it doesn't spread further into other populations and more groups become at greater risk. Joy, anything you'd want to highlight?
No, I would just like to say again, thank you for that question, Casey. And as far as, the myth that Dr. Washington was discussing, a lot of what we think about, what we know about the population that's being affected is based on relationships we have with that population about being in care and having honest conversations. So kind of this malicious spread of misinformation, we don't want that to stop those conversations, because ultimately our goal is to prevent transmission of monkeypox. So thank you.
Next question goes to Claire Donnelly, WFAE.
Hi there. Thanks so much for doing this. I'm wondering how contact tracing is going for monkeypox. We know that with COVID, you all struggled to get folks to answer the phone and then to find those close contacts. How's it going with monkeypox?
Hi, good morning. So with monkeypox, we have had great success with reaching those people who test positive. And part of that may be conversations that are happening on the front end from providers who are providing the testing to make sure they get accurate information and inform people that we will need to have some kind of detailed conversations if they test positive. So, however, again, as I mentioned, we don't want this population to feel stigmatized or to prevent this flow of information so that we can protect those contacts by spreading misinformation.
Just a quick follow-up. Are you having trouble getting folks to answer the phone or respond to texts, like close contacts?
We have not, that has not been our experience at this time.
Next question, Tony Mecia.
Thanks. Question on monkeypox, just on some of the data. How many cases are we talking about in Mecklenburg County, and what percentage of those cases are outside of the gay male population? I mean, and are you seeing any spread? How would you characterize the spread in that non-MSM population?
So Tony, I think, Joy, you want to remind me the number of cases this morning? Is it 34?
33 cases.
33. So we're up to 33 cases in the county. And then, as I think Joy mentioned earlier, the majority of those cases continue to be have the risk of being a male that has sex with other men. But I don't have an exact percentage of the total that I can share at this time.
Okay, thanks. I mean, do you have any idea what the spread? I mean, initially this was thought to be something that was mostly in that community, and I know you're saying the majority of cases are. Are you seeing more spread outside of that community, or how is there a way to characterize that?
So I'll say this, Tony. I think again, I can use the word sort of majority to qualify sort of the percentage, but I'm hesitant to provide an actual percentage. But I will tell you that we do